Morning, everyone, and today we are going to discuss diseases of external ear. In the last lecture, we had discussed the anatomy and physiology of the ear, and as you know, external ear is basically the auricle, the external auditory meatus, and the lateral side of the tympanic membrane. So, we are going to discuss the diseases which are related to these structures. So, first of all, in the disease of external ear, first of all, we are going to discuss the pinna disorders. Now, there could be congenital disorders, traumatic disorders, inflammatory disorders, as well as um, neoplastic disorders. The importance of these disorders is not so much but we will cover uh, them one by one. So, you can say that there are many congenital abnormalities uh, which can affect the ears. For example, you can see over here bat ear. Uh, we also call it, as you can see over here, we also call it as prominent ears or protruding ears. So in this one, like the concha is enlarged with, you can say, a very poorly developed antihelix, and uh, many people they have what you can say this bat ear, but this abnormality can be cleared, can be corrected surgically before the after the age of 6 years. Then there is something called as pre-auricular appendages. You can see over here these appendages, and these are skin covered tags that appear on a line drawn from the tragus to the angle of the mouth. And so see, you can see over here these skin tags are there. Next, there could be pre-auricular pit or sinus. You can see this one, and this is most commonly seen um, in front of the crus of the helix or above the tragus. And basically, this is a epithelial tract, and it is due to incomplete fusion of tubercles. Like, to understand this thing, of course, you must know what is how the ear is developed. So simply, there is a incomplete fusion of these tubercles, and the one of the thing which can present is infection of this one. So you can see over here the pus is coming out in this one, and of course, like, treatment is surgical excision or treating the infection by antibiotics. Then you can see over here anotia. Anotia is like when there is complete absence. You can see over here complete absence of the pinna and the lobule. There could be macrotia, in which, like, the ears are quite bigger, or like excessively large pinna, and microtia, in which the ears are very, very, very small. You can see in this girl. Microtia is a developmental anomaly, and many of the time it is associated with auditory canal and middle ear, even internal ear disorders as well. And it could be unilateral and it could be bilateral. So they also call it as peanut ear. Then there are many others like cup ear or pocket ear or things like this. But of course, like, depending on the shape of the ear. Trauma to the auricle. Now, you can see, like, here it is written hematoma of the auricle, and you can see like a hematoma formation, the collection of the blood. So of course, like, it is a collection of the blood between the auricular cartilage and the perichondrium, and it is usually as a result of fist fights or a blunt trauma, especially in boxers or people who have contact, like who play contact sports, football and hockey, things like this. Now the problem here is what? Remember, the pinna is made up of cartilage, and the blood may clot and organized. And in that case, we call it as cauliflower ear. See this one. So this hematoma can get infected as well and can result into perichondritis. So the treatment is very important, because and the treatment is simply aspiration. See, like they are putting this needle and they are aspirating the blood out of it. And after doing this aspiration, what they do is pressure bandage. See, they put something like this inside and they are going to bandage it. So they have to create the pressure, or this is called as pressure dressing. And why this thing is important, because we don't want more blood to collect over here, because the blood can collect and organize. Sometimes recurrence do come, but again, if there is recurrence, so what they do is like they again aspirate and they again do pressure dressing. And of course, like surgery can be done as well. And we don't want them to organize over here and destroy the cartilage. Lacerations can occur. You can see over here, this is a laceration of the left pinna. And of course, these lacerations should be repaired as soon as possible. And the perichondrium should be stitched with absorbable sutures. And we give antibiotics, broad spectrum one. Avulsion of pinna, like of course when pinna is still attached to the head of the small pedicle of the skin, primary reattachment is considered. But sometimes when it is completely cut off, so of course we see the viability of the tissue, and then we like the doctors, they discuss like either it could be like you can say implanted or not. And you can see over here the patient 24 hours after post-operative, and like 6 days post-operatively and 2 months post-operatively. Many of the times, like when they lost their ear, so in that case we can give them a prosthesis like this. So see the ear prosthesis over here. So this is like avulsion of pinna. Frostbite can occur. Frostbite, as you know, what is frostbite? Frostbite is basically injury due to cold. Whenever like there is cold temperature exposure, like, and frostbite can occur in the tips of the fingers, tip of the nose and ears. So there is erythema, there is edema, there is bulla formation, there is necrosis of skin as well as subcutaneous tissue, and complete necrosis can be there, in which like of course the affected part can be lost. So how we treat them? Of course, we reworm them. We apply silver nitrate. For superficial infections, we give them painkillers or analgesics. We give them antibiotics to avoid infections, and surgical debridement is done if there is a dead tissue. And the last thing is keloid formation. So keloid formation, it is more common in African race, and simply how we define keloid is when there is a scar tissue which is forming beyond the boundaries of that injury. So you can see, like in this woman, there is a ear piercing and there is a big keloid, and even in this one, like after ear piercing, the keloid is there. So simply it follows trauma or piercing, and the usual sites are the lobule of the helix, and surgical excision is done for these patients, and sometimes recurrence is there, so again surgical resection. Okay, but when there is again and again like recurrence, so we can give them post-operative radiation. Sometimes we give them intra-lesion steroid injection after excision. Then there could be inflammatory disorders, as you can see over here, perichondritis, which is the inflammation of the pericardium. So of course, like it results from the infection, and The infection is secondary to some sort of injury like laceration, hematoma, or surgeries, and uh, this infection can spread inside the canal, which is called as otitis externa. We are going to cover this in this lecture as well. And Pseudomonas is a very, very common pathogen, and most of the time it is mixed pathogens as well. So, of course, like the patient, they present of a red, hot, painful pinna, and on examination, you are going to see the same things. And the bad thing is, like, if we will not control this thing, it is okay, will cause destruction of the cartilage or necrosis of the cartilage. So uh, remember, the cartilage can only get its blood supply from the pericardium. So treatment is simply we can give them local application of ammonium acetate compresses. But if abscess is formed, of course, drainage is done with antibiotics for 7 to 10 days should be given to these patients. So this is perichondritis. Relapsing perichondritis. Now, of course, like this is autoimmune condition in which the immunity basically causes inflammation of the cartilage, and not just ear, but like the cartilage of the trachea, larynx, they can be affected as well. And you can see the redness over here, we can see over here, and the inflammation, the redness, and of course, like whenever it is autoimmune, so the treatment will be steroids. Chondrodermatitis nodularis chronica halicus. The name is very, very long, but believe me, this is not important. But as we are studying the conditions which are related to the external ear, so these are basically small painful nodules you can see over here, which appear at the border, like the free border of the skin, you can see over here. And it is more common in men above 50 years of age, and they are tender. The patients complain of pain. They couldn't sleep on the affected side, and treatment is simply excision of the skin, the cartilage, and the nodule. Now comes the disease of the external auditory meatus. So you can see over here, like the diseases which affect the external auditory meatus are grouped as congenital, trauma, inflammation, tumors, and other conditions. So again, starting from congenital, there could be atresia of the external canal, like simply the external auditory canal is not present. You can see the CT scan over here. There is no external auditory canal. And of course, it's a congenital atresia, and it is associated with microtia, small ear. And simply there is failure of canalization, and we do a CT scanning, or we see like what is the condition of the internal ear, either the structure is present or not, either the tympanic membrane is present or not, and whatever the condition, of course, like depending either the internal ear is present or not, surgical procedures are done, but simply when these structures are abnormal, so we can just put prosthesis. Oral fistula, you can see over here the fistula. So this is abnormality in the first brachial cleft if you've done embryology, and this one have two opening. One is situated in the neck, you can see over here, neck just below, and one is behind the angle of the mandible. So this one is the behind the angle of mandible, and one is below in the neck. Now sometimes it do open in the external auditory meatus. And remember, whenever there is fistula or this tract is present, we have to do a surgery to remove that. Other than, of course, we cannot do anything. Trauma to ear canal is very, very, very common. It could be minor, or it could be major. You can see over here, like someone put a cotton bud and rupture the tympanic membrane. So Minor lacerations of the canal are common with scratching of ears with hairpins, matchsticks. Like not in China, but I've seen many people, like, when they're sitting, they have nothing to do. They can take a matchstick, they put a tissue or a cotton in front of that and try to play with the ear. Sometimes put keys in their ears. That's a very, very bad practice. But most of them, they heal without any complication. And major lacerations which result from gunshot wounds or fights, of course, like in that one, like not just this, rather there is some other trauma effects as well. So that sometimes needs surgical management. Now this is a very, very important topic, guys, that is inflammation of the ear canal. So when it comes to the inflammation of the ear canal, we call it as otitis externa. And this is an important topic. Like out of all these topics which we are studying today, this one is an important topic, which is otitis externa. So it can be classified into infective group and reactive group. So infective group can be further classified like the infections is caused by bacteria, fungal, or viral. And you can see like over here, localized otitis externa, diffuse otitis externa. Malignant otitis externa is the most important topic in this one. And fungal infection is otomycosis, whereas viral infections are there. And in the reactive group, there could be eczema, there could be seborrheic, there could be neurodermatitis. So, furuncle. Now, if you have, like in general surgery, we have done furuncle. So this furuncle is nothing different from that furuncle. Just the important thing is, remember, the skin in the external auditory meatus is quite tight. So whenever there is furuncle formation, it is very, very painful. So as you know, the furuncle is mostly caused by staphylococcal infections in the hair follicle. And these hair follicles are usually confined into the cartilaginous part, not the bony part. Why? Because the skin over here have those glands, sebaceous glands, or the hairs. So this is the area, or the outer area of the canal is going to affected by this one only. So usually the furuncles can be single or it could be more. So you can see over here. And they have a severe type of pain. They have tenderness depending on the size of the furuncle. And when you move the ear of the patient, it is very, very painful. When they eat food, due to the movement of the jaw, it is very, very painful. And sometimes the furuncle is so severe, like it can completely block the external auditory meatus. The lymph nodes can be enlarged as well. So how we treat these patients is simply, depending, like if there is abscess formation, of course we have to drain the abscess. But whenever there is no abscess, or whenever there it is without abscess formation, we give them systemic antibiotics, painkillers, and we can give them local heat. And see, we can do this ear toilet. So what is this ear toilet is? Like they can put 10% istamol glycerine. This one is antiseptic basically, and you can put it inside the ear. So it is more common in the people who have diabetes, by the way. Then there is diffuse otitis externa. So as the name shows, diffuse means there will be diffuse inflammation of the skin. It can involve the pinna. It can involve the epidermal layer of tympanic membrane. It is more common in hot and humid weather. The people, they go for swimming, or if like there is excessive sweating. So you can see over here, whenever there is excessive sweating, basically what happens is it changes the pH of the skin from acid to alkaline, which favors the growth of the bacteria. You can see over here, diffuse otitis externa. So there could be trauma to the skin, or there could be, well, like when it is especially like when you are excessively sweating, or when you're going for swimming, the skin can have trauma over here, which can lead to infection. So of course, like the trauma can be due to scratching, can be due to, again, like manipulating your ear with with anything. Like many people, they do this thing. Like for example, after swimming, you are cleaning your ear and you are going to give some trauma. And the organisms which causes this thing is Staphylococcus aureus or Pseudomonas, most commonly. And sometimes, it is due to infection of the internal auditory meatus. So you can see the clinical features. Of course, like it is painful. The patient complain of pain. There could be discharge coming out from the ear. You can see in patients like the discharge is coming out. And when you will examine them and you're going to move their pinna, it will be more and more painful. You can find the enlarged lymph nodes in these patients. So how we treat these patients is simply we give them ear toilet, okay, clean the skin from the ear, take out all the debris, and once the debris is cleared, then we should dry the ear by mopping or by suctioning, and then we can put up medicated wicks. So medicated wicks, of course, like they are covered with medication. They have aluminum acetate or silver nitrate. They are antiseptic as well as bactericidal or bacteriostatic. You can give them broad spectrum antibiotics, give them for pain relief. So this is how we treat these patients. And the aim is to keep a ear dry and clean in these patients. Otomycosis is a fungal infection of the ear. And again, the organism which causes this one is Aspergillus or candida species. It is seen in hot and humid weather. And the clinical features are, maybe the patients complain of itching or discomfort in the ear. And when we examine these patients, we can see a white, brown, or black type of mass depending on the species, fungal species which is causing this infection. So of course, like we use otoscope to examine the ears. So Aspergillus niger appears black, whereas Aspergillus fumigatus appear blue or green, and candida, remember, it appears white or creamy. So what is the treatment? Treatment is simply ear toilet, remove all the discharge, remove all the epithelial cells, which can be done by syringing, by suctioning, by mopping, and then we give them antifungal drugs, nystatin, clotrimazole. So any of the antifungal agents can be used. So this is how we treat these patients. And again, like keep the ear dry, okay, and keep on examining the patient if he is getting any bacterial infection. So treat for that. Otitis externa hemorrhagica. It is also called as bullous myringitis. So it is characterized by formation of hemorrhagic bulla. You can see over here on the tympanic membrane. It is mostly viral in origin and seen in influenza seasons, but it is very painful, and sometimes a blood stained discharge can come out from the ear as well. And treatment is simply we give them painkillers with antibiotics for secondary infections. So this is otitis externa, hemorrhagica. Herpes zoster oticus, like it's a herpes zoster infection as the name shows. So when we examine the tympanic membrane in these patients, like we can see the vesicles, and sometimes it involves the 7th and 8th cranial nerves. Now, malignant otitis externa is very important. This is also called as malignant necrotizing otitis externa or necrotizing otitis externa. Of course, it's an inflammatory condition which is caused by infection, and remember, the infection is caused by Pseudomonas. So why I'm talking about Pseudomonas? Because remember, we should give them anti-pseudomonal antibiotics. So most of the time, this kind of infection is seen in diabetic or immunocompromised people, and this is highly painful, and you can see the granulation tissue in the ear canal. Sometimes because the 7th nerve is passing over from here, so it can cause facial nerve palsy or paralysis of facial nerve. And this infection basically can spread to the skull base. Anteriorly, the infection can spread into temporomandibular fossa, and posteriorly it can go to the mastoid ear cells. And medially, this infection can spread into the middle ear. How we diagnose this condition is simply, if you found severe ear pain in a diabetic patient who is, or an elderly diabetic patient, and on examination you are seeing a granulation tissue, then it should alert you for the diagnosis of necrotizing otitis externa. See, in this case, we go for CT scan as well to look for any bony destruction. And now, the important thing in these patients is to control the diabetes. Again, we can do ear toilets, remove discharge, remove debris, remove granulation tissue, remove dead tissue, and we give them anti-pseudomonal antibiotics. And the antibiotics are given for 6 to 8 weeks. So the antibiotics which we can give is gentamicin with ticarcilline or third generation cephalosporins like ceftriaxone, or you can give quinolones like ciprofloxacin, moxifloxacin, ofloxacin, norfloxacin, all these drugs. So, and of course, remember, like before starting antibiotic, always take a culture and send it to the lab for culture and sensitivity. So there are other conditions like eczematous otitis externa, like this one is simply in the people who have eczema, and with eczema, when they have oozing and crusting in the ear canal, it is called as eczematous otitis externa. And seborrheic otitis externa, which comes in combination with dermatitis or seborrheic dermatitis. So these are the things which can be there. Okay, so in miscellaneous conditions, if you can see over here, there could be impacted wax. Now this is something very, very, very common thing, guys. You are going to see a lot. Of course, like the wax is composed of secretion from the sebaceous glands and ceruminous glands or hair or desquamated epithelial cells, keratin and dirt, and simply when this thing is collected, it can block the ear canal or it can impact anywhere. So, what is the function of the wax? Wax is basically a protective thing, and usually it dried up and it is expelled through the meatus by the movement of the jaw. So, some people they produce more wax and some people they produce less wax. And whenever there is wax impaction in the external ear, the patients they present with complaint of hearing loss, less hearing, decreased hearing. Sometimes the patient do complain of tinnitus or ringing of sounds and giddiness. And sometimes, like there is cough. Why? Because, vagus nerve give auricular branch of vagus nerve, which is innervating this area. Whenever it is irritated, it can initiate the cough. And whenever the cough is like long standing, it can ulcerate the skin as well. So how we remove the cough? So how we remove the wax, by the way, depending on how much wax is there, the treatment is removal of the wax by syringing or by using different instruments. And you can see over here they are showing you the technique of the syringing. Like they put a kidney tray below the ear, and to make the tympanic membrane straight, they pull the ear upward and backward, and then they are putting a stream of water. And of course, like the water is going to expel the wax out. But sometimes when the wax is tightly impacted, then we have to use instruments to take it out. So this is how they are going to do this. So this one is with instruments. Like of course they can put instruments and they can take this thing out. So if the wax is too hard, like it could not be, it's not coming out by syringing or by manipulation. It could be softened by putting some drops like sodium bicarbonate or glycerine, and then waiting for some time. And once like that is done, so then we can remove that. Then there could be many foreign bodies in the external auditory canal. And by the way, foreign bodies are so common in children that it's very common for the children to see with a piece of paper, sponge, seeds, rice, small pieces of balls, their toys, and anything. We can also have insects, flies, and maggots as foreign bodies. Like recently, my brother's son, he's 6 years of age. He put a small piece of rubber inside his ear, and it took them almost 3 to 4 visits to the hospital just to remove that, because they remove it under anesthesia. Because when the child is not cooperative, so they have to do that. Or sometimes the removal is hard because like the normal instruments, they cannot take it out. So how they can remove it? It could be a forceps removal, it could be syringing, suction, microscopic removal with special instrument, it could be post-oral approach. So, of course, whenever it is a living animal, so like mosquito or small, any bee or fly, they are going to enter in the ear canal, they cause intense type of uncomfortable feeling, sometimes pain, even irritation. So there should be no attempt should be made to catch them alive. Rather, what they do, like they put some oil to kill it, or you can say a chloroform water. Once it is killed, then they can remove it. So first of all, it should be killed and then it should be removed. And whatever is non-living, of course, it should be removed by the help of forceps. And if the child is restless or struggling, then we give them general anesthesia to remove any foreign body. So any child who is not cooperative, we remove that thing under anesthesia. One of the things is keratosis obturans. Okay, not so important, but of course, like we are discussing the conditions, all the conditions related to, not all, but like, so what is this? Like, this is collection of the pearly white mass of desquamated epithelial cells in the deep meatus. We call it as keratosis obturans. And see, by its pressure, it causes absorption of the bone, which causes widening of the meatus. See, you can see over here the widening. That leads to exposure of facial nerve and nerve gets paralyzed. It is commonly seen in 5 to 20 years of age and may affect one or both ears. And it is associated with bronchitis as well as chronic sinusitis. And the clinical features are simply pain in the ear, hearing loss, deafness, tinnitus, ear discharge, and on examination we can see the whitish mass. And when we remove that mass, we see the widening of the skin. What is the treatment? Again, it should be removed by syringing or instrumentation. And if there is any otitis externa, it should be treated as well. So this is a thing. Disease of tympanic membrane. So first of all, you must know how a normal tympanic membrane looks like. I explained this thing in the previous one. Shiny pearly gray in color with concavity on its lateral surface. There is tip of malleus we can see, and we can see a bright cone of light in the anterior inferior quadrant. And attic area as well as the lateral process of the malleus is like quite pinkish. So, and a normal tympanic membrane is mobile when we check it by pneumatic otoscope. So see, this one is, so one thing is retracted tympanic membrane. See this one. So this one is like it appeared dull and lusterless, colorless, you can say. And the cone of light is absent. And the handle of the malleus, as you can see, like it seems shortened. So why this thing happened? Because the Eustachian tube, which is basically maintaining the pressure of the middle ear, this one is blocked. So that's why like the tympanic membrane gets retracted. One of the things is called as myringitis bullosa. It is painful condition, which is characterized by formation of blebs. You can see hemorrhagic blebs. And it is as a result of virus or mycoplasma pneumonia. Rupture of the tympanic membrane is also a common thing, and of course like traumatic rupture can occur due to trauma, due to foreign bodies, due to air pressure changes, like if you will slap someone and due to pressure changes, or sometimes due to forceful Valsalva maneuver, like when you will close your nose and close your mouth and try to blow or create pressure inside. Sometimes it is related to the fracture of the temporal bone. And what is the treatment? Simply treatment, like of course the patient, they present with conductive deafness and earache, bleeding, vertigo. Otoscope will show you the rupture. And what is the treatment? Of course, like in majority of the cases, we examine the ear under the microscope and try to readjust or bring the things back to their normal position. So this is what they do. And we ask the patients not to put any ear drops, or syringing is avoided. Rather, we put a sterile cotton wool inside. And swimming and bathing are, of course, should be avoided. Why? Because they can cause infection. And if there's chance of infection, of course, you will go give broad spectrum antibiotics. And if it is associated with nasal decongestion, like a blocked eustachian tube, then antihistamines or decongestants can be given. And the surgery which we do to fix this thing is called as myringoplasty operation. Tympanosclerosis. So it is hyalinization and calcification of the fibrous layer of the tympanic membrane. You can see over here. And it appears like white, chalky white in color. Most of the time it is asymptomatic. And sometimes it do involve the other parts of the structure as well, like the tendons and the ossicles and all this one. And it also interferes with the conduction of the sound, so it can be a cause of conductive hair deafness. So this is all about the tympanic membrane and external auditory meatus conditions. So one thing is called as Ramsay-Hunt syndrome, like which is due to herpes zoster infection, and it affects like some dermatome. So whenever like the dermatome is involved, so what we can found is a very highly painful type of rash over here around the ear. Can result into facial palsy as well. So again, you can see like some photographs of anomalies and how they remove it, how they close the defect. These are the tumors: gouty tophi, seborrheic keratosis, solar keratosis. I show you this thing: chondrodermatitis helicus nodularis chronica. This one is called as Darwin tubercle. This one is keloid scarring. This is the cancers of the skin. This one is like basal cell carcinoma. This one is squamous cell carcinoma on the patient. So thank you so much guys for listening, and I will see you in the next lecture.